So the session that I was talking in was really focusing on what are some of the global and regional lessons that we can learn for accelerating progress towards ending preventable child deaths. We came home with 4 key messages. There are 4 key lessons that we've learned in terms of improving the situation. It's about leadership, it's about accountability, it's about equity, and it's about systems for delivery. Leadership is about making sure that children are number 1 on the agenda, because tough decisions have to be made. Tough decisions regarding prioritization of resources, tough decisions regarding where to put the money and the resources for children. That relates to the second thing, which is equity. What we're discovering more and more is that the gap between the rich and the poor can get wider unless we pay specific attention. More deaths are now occurring amongst the poorest children, and therefore we must have leadership and a focus on putting more resources towards where the poor children live and die. That relates in turn to the third aspect, which is how do we deliver the system. And here, the challenge we've been facing is not enough doctors and nurses, and when there are enough, quite often not willing to go and work in those poorest areas. And that's where things such as community health workers, home-based care, improving primary health care can make the big difference. And so a lesson we've learned is that we have to be innovative and use innovation to change the way in which we deliver. And the final and perhaps most important thing for India in particular, and the Minister has been stressing this, has been accountability. That we have many times have plans, many times we have rhetoric, many times we have meetings, but not enough times do we actually measure and monitor whether things are changing on the ground. And if they're not changing, we don't enough times go and ask people and get their insights as to why things are not changing, because often the solution lies with the people and lies in the communities and lies with the health workers who have the solutions but do not have the power to implement those solutions. So accountability, equity, leadership and delivery are the 4 key